Okay, this is Kelsey Belcher. This is my final head-to-toe assessment and my 360. I'm stating before the video starts that my equipment was cleaned before the patient walked into the room, so all my equipment is clean. Okay. Hi, how are you?
Good, how are you?
Good, my name's Kelsey. I'm going to be your nurse today, okay?
Okay.
All right, I'm going to perform hand hygiene. Can you tell me your name and date of birth?
Kelly Joe Dennis, 3501.
Perfect. And what brings you in today?
I got some wrist pain.
Okay, perfect. So real quick, general impression is when I'm talking to her, she makes eye contact. I understand that she's comprehending what I'm saying and she's answering nicely. She is dressed appropriately. Her clothes are free of holes. I don't smell any odors as I walk in. Her hair is a nice shiny, clean consistency. Her skin is appropriate for her ethnicity. It lacks diaphoresis. There's no abnormal coloring. I don't see anything that's jumping out at me. No lesions, no bruising, anything like that. She's sitting at a good posture and she's not showing signs of too much pain or respiratory distress. So, okay, Kelly, you said you had wrist pain.
Mm-hmm.
Can you tell me what you were doing when the pain started?
I was cleaning up my car. I think I bent it a weird way.
Okay. And does anything make it better or worse?
Ice and resting it helps, but moving it a lot and pressure kind of hurts.
Okay. If you could describe the pain for me.
Sharp gnawing.
Okay. Does it radiate anywhere?
My fingertips and up to my elbow.
Up to the elbow, okay.
Mm-hmm.
And then if you could rate the pain from 0 being no pain, 10 being the worst pain you've ever felt, what would it be?
Right now it's at a 5, but I can get up to an 8.
Okay. And then you told me that it was when you were doing your car,
Mm-hmm.
when you were cleaning out your car,
Mm-hmm.
but how long ago? How long has this been happening?
That was about noon to about 8 hours ago.
Okay. And have you taken any over-the-counter medications or anything?
Tylenol, but it didn't really help.
Didn't help. Okay. I will note that. I'm going to get a set of vital signs for you. Before I do that, I'm going to give you 3 words.
Okay.
I want you to try to remember them, okay?
Okay.
The words are cat, mouse, dog.
Okay.
All right. The very first thing I'm going to do is I am going to find the systolic threshold. First, I'm going to find your brachial arteries, okay?
Okay.
Find them right in here, right in the inners of your arms. Oh, I found that one right away. Okay, so the right arm is definitely a 2+ palpable. The left arm, I'm unable to palpate right now. So what I'm going to do is I'm going to put this around your arm. And I'm just going to pump it up until I can no longer find your radial pulse, okay? Mm-hmm. All right. And then is there any reason that I can't take it on this arm? I know this arm's injured, so, okay.
Yep, you're okay.
All right. Perfect. I'm going to find your radial pulse here. And I am going to check it in this arm as well, okay?
Okay.
And it is present, the radial pulse is present at a 2+ bilaterally. So I'm going to pump this up until I can no longer palpate the radial pulse, and then after, when I do take the blood pressure, I'm going to pump the cuff up to 30 millimeters of mercury above that. All right, you ready?
Mm-hmm.
It's okay. There we go. All right, I stopped hearing it at 150, or I'm sorry, 120. So I will pump it up to 150 when I do take her blood pressure. I'm sorry.
I'm like, please, no.
I'm gonna let that arm rest for a minute.
Okay.
I'm gonna take the rest of your vitals. I'm gonna get a temporal temperature right across the forehead here. And it is 98 even, which is great. We want it between 97.7 and 98.6 degrees Fahrenheit. I'm going to take the pulse ox, put on your finger here. We want it between 95 and 100%. And we are at 100%, so that's good. All right, I'm going to come down here and I'm going to actually take your radial pulse this time, okay?
Okay.
I'm going to count it for 30 seconds.
Okay.
say radial pulse is still a 2+ on bilaterally. Okay. What I did was I counted the radial pulse for 30 seconds and then I counted respiration for 30 seconds. I got 45 for the pulse, which is good because that means it's 90. Where we want it between 60 and 100 for adults. And then her respirations were 7. I'm going to times that by 2. We get 14. And that falls between the perimeters of 12 and 20. So, all right. I'm going to take the blood pressure, okay?
Mm-hmm.
I got 114/74, which is good. We want the systolic to be between about 100 and to 120 and the diastolic between 60 and 80. So it fell in between the perimeters. So that's good. All right, Kelly Jo, can you tell me the 3 words that I told you to remember earlier?
Cat, mouse, dog.
Perfect. All right, so she passed the mini mental, and I'm also going to say that she is oriented to time, place, and person because she told me her name, date of birth, and why she came in today. All right, I'm going to move on to the hair, skin, and nails, okay?
Okay.
First, I'm going to inspect your hair. I see that it's nice and shiny. It looks healthy. It looks clean. I don't see any bugs or any debris, anything like that upon inspection. It's got a nice clean smell to it. I'm going to feel for bumps, bruises, lesions. Look a little bit harder for bugs. Not finding anything that's concerning. Hair, scalp looks good, clean. And there's no patchiness, nothing, it's not brittle, anything like that. So I'm going to move on to the skin. Skin looks dry. Nothing concerning to the touch. Hair is evenly distributed. I see she's got a tattoo on that left forearm there. No signs of edema. I'm going to rate edema a 0. Her arms look symmetrical. There's no moles, anything out of that are asymmetrical, nothing on her arms, bumps, bruises, lesions that I'm worried about. I'm going to come down here, test capillary refill. And it is almost instantaneous in all of the fingers, which is good. We want it under 2 seconds. They look healthy and nice pink nail beds. Her nails are a good little thickness. Can you do a heart for me? And figure 8. All right, so there's no signs of clubbing. And then before we move on, I'm going to just check skin turgor, okay?
Okay.
We're going to do that right here. It's a little pinch. Instantaneous there, and then right on the clavicle. Also instantaneous. So what that does is that checks like the hydration and elasticity of your skin.
Okay.
All right, so I'm going to move on to the head. So the head looks like a good appropriate size for her body. All her facial features look symmetrical. Is it okay if I touch you?
Mm-hmm.
Okay, perfect. So I'm going to come right here and check temporal arteries bilaterally. They are 2+ and palpable. And I'm going to move on to your sinuses. You let me know if there's pain, tenderness, pressure, okay?
Okay.
Anything in the frontal?
No.
And then next is the maxillary.
Mhm.
Nothing?
Nope.
All right, I'm gonna move on to your lymph nodes.
Okay.
All right, and there's preauricular,
Mhm.
postauricular. You let me know if there's any pain, tenderness.
Okay.
Occipital.
Mhm.
Posterior cervical chain. Supraclavicular. Tonsillar. Submandibular and submental. Any pain, tenderness, anything like that. Okay, and there's no hard fixed areas noted in palpation of the lymph nodes. I'm gonna have you just kind of grit your teeth together like this. Perfect, and press down for me. Perfect. Cranial nerve 5 is intact. Can you smile for me? Frown. And then puff out your cheeks. Cranial nerve 7 is intact. I'm going to palpate carotid arteries one at a time. Palpable at a 2+. Also palpable on the right side is a 2+. With the bell of my stethoscope, I'm going to check for any swooshing or bruit sounds in either of the carotid arteries. Maybe a little cold, okay?
Okay.
Okay. Both carotid arteries are absent of bruits. So, next, Kelly Jo, I'm going to find your trachea. Okay, I want you to look straight at me. It does look midline. I'm going to use that as a base point here. And then can you swallow for me? Perfect. Cranial nerve 9 and 10 are intact. I'm going to give her a drink of water. What I'm going to have you do is I'm going to have you swallow this drink of water. I'm going to check your thyroid, okay?
Okay.
Come behind you here. There is an upper and lower left and right thyroid. I'm going to just check and see if there's any inflammation or anything out of the ordinary. All right. Any pain, tenderness, anything of concern? All right. Her upper and lower left and right lobes were barely palpable, which is good. I see no signs of anything abnormal. Thank you. All right, I'm gonna move on to the eyes, okay? All right, I'm gonna put on gloves and perform hand hygiene. On inspection, I don't see any styes, no redness, no signs of jaundice, no broken blood vessels, anything like that. Her pupils look equal. She's looking at me and following me with her eyes as I speak. That's good. All right. I'm going to pull down on your eyelids, okay?
Okay.
Can you look up, down, left, to right? Perfect. Her conjunctiva looks nice and pink. Her sclera is a nice white color, as I said, as even on closer inspection. There's no broken blood vessels or nothing floating in there, no impactions, nothing like that. So, next thing, Kelly Jo, I'm going to have you do a visual acuity test.
Okay.
I want you to cover one eye, hold that 12 to 14 inches from your face, and let me know the line you can read before it starts to get blurry.
Oh, sorry. 384.
Okay, and now the other.
And 1024.
Perfect. So in the left eye, she is 20/60, and then the right eye, she is 20/20. So visual acuity is intact, and that is cranial nerve number 2. Next, I'm going to do the 6 cardinal fields of gaze and accommodation. I'm just going to need you to follow my pen with your eyes while you leave your head straight, okay?
Okay.
All right. She was able to follow my pen, and then her eyes accommodated as I got closer to her nose. So that is cranial nerve 3, 4, and 6 are intact. So next, I'm going to check for pearl. Good. Pupils go from about a 4 millimeter to a 2 millimeter and are equal, round, and reactive when I shine the light in their eyes, so that's good. Next is going to be corneal light reflex. It checks for strabismus. You're gonna look straight ahead, and I'm gonna shine light in your eyes, okay? Perfect. Left and right eye are both absent of strabismus. If I had a scope with a red light on it, I would check red light reflex width, which checks for tumors. So, I'm gonna take my gloves off, perform hand hygiene, and move on to the ears. All right, Kelly, I'm gonna pull your hair back just a little bit, okay?
Mm-hmm.
Sorry. That's okay. Okay. On inspection of the ears, I don't notice anything out of the ordinary. No lesions. Nothing that I need to look into further. On the left ear, right ear is intact as well. No lesions, no growth. There's no excess drainage or anything that is concerning to me. I'm gonna pull up and back on this ear here. If I had a scope, I would be looking through. I would be looking for a grayish white pearl colored tympanic membrane. I'd be wanting to locate the cone of light, and then I'd also want to make sure that there was cilia in there, no redness, no inflammation, no excess drainage or anything like that. Come to this side and do the same. Pull up and back and look for the same thing, the white gray tympanic membrane, the cone of light, and the cilia. So I'm going to do a whisper test on you, okay?
Mm-hmm.
All right, I'm going to say 3 words. You try to remember them, okay? You repeat them back to me.
Little house love.
Perfect.
Plant, mind, pray.
Perfect. Okay, so she passed the whisper test, which is cranial nerve number 8. So I am going to move on to the nose. And her nose looks symmetrical right now. I'm going to inspect closer. If you could look up for me. All right, upon inspection, her nares look patent. Septum, it does not look deviated. I see no occlusions. I see a few little hairs. Turbinates are nice and moist and pink. Air is flowing through the nostrils. Can you occlude one nostril and breathe in and out? And the other? All right, that proved patency. And now I'm gonna do a smell test on her. Go ahead and close your eyes, Kelly Jo. I'm gonna wave something in front of your nose. You let me know if you recognize the smell, okay?
Hand sanitizer.
Yes. So cranial nerve number 1 olfactory is intact. So I am going to now move to the mouth. And I'm going to put on a new pair of gloves. And then upon inspection, I see that her lips look a nice healthy pink. There's no cyanosis, no pallor. There's no lesions, no cuts, anything that's concerning at this moment. I'm going to open up a tongue depressor. Maybe. Okay. All right, Kelly Jo, I'm going to have you open up for me. I am going to inspect the oral mucosa. I'm going to have you stick your tongue out. Tongue is free of cuts, lesions. I'm going to inspect the hard palate. It's intact. I'm going to have you lift up your tongue. There's no growths under the tongue, nice and vascular. Soft palate is also intact. There's no bleeding of the gums, no broken teeth. Can you stick your tongue out for me and say ah? Her uvula jumped, so that's cranial nerves 9 and 10, and I also noticed that she is absent of tonsils, so I'm going to rate those a 0. So, cranial nerve 9 and 10 are intact. Everything else is good. Can you say light, tight dynamite for me?
Light, tight dynamite.
Perfect. That's cranial nerve number 12 is intact. So, I am going to take these gloves off, perform hand hygiene. And then I am going to move on to the lungs. I'm going to move on to the lungs, yes. Okay, so first, if you could just pull your shirt right down, Kelly Jo, I'm gonna inspect. Is there anything that concerns you about this area? Okay, I don't see anything concerning, no lesions. There's nothing pointing out at me. There's nothing asymmetrical about her chest at this area. So I'm just gonna auscultate, okay?
Oh,
I'm
sorry.
gonna check the bronchioles, and then I'm gonna move to the posterior. Go ahead and breathe. Okay. Perfect. Bronchials sound clear. I'm gonna come to the back. Is it okay if I do it over your shirt?
Yeah, you're okay.
All right. Come here, you just breathe. In here, breathe. Good. And over here. I'm gonna do it a couple extra times in the mid-axillary or the axillary midline because that right lobe has that right lung has an extra lobe. Good. Lungs are absent. They sound nice and clear. Bilaterally, they're absent of any wheezing, crackles, any lung issues. Real quick before we are done, I'm gonna check your cervical spine here. From the cervical, thoracic, all the way to the lumbar. Any issues there? Okay, it seems nice and aligned. All right, perfect, thank you. All right, next I'm gonna listen to the heart. All right, first, I would inspect the chest since her shirt is on. Do you have any issues in that area? We're gonna say that it's nice and symmetrical, free of bumps, bruises, lesions, or anything of concern. Okay. I'm gonna listen up in the second intercostal space for the aortic. Here, pulmonic. In the second intercostal space, a little more to the left. Herb's point in the third. Sorry, Kelly Jo.
You're okay.
Yep, tricuspid in the fourth. And I'm gonna lift up, I'm sorry.
You're okay. Do it.
And mitral in the fifth, which is also the point of maximal impulse. It's where I'm gonna listen for 1 full minute.
You're okay. Got it.
I'm gonna do that, yeah, is that okay, or would you like to lay down?
Oh, I'm fine either way.
Okay.
Whatever you prefer.
Perfect. I got 98.
Good.
So the next thing I'm gonna do, I'm just gonna try to palpate that real quick, okay? From the fifth intercostal space. And I am unable to palpate. So, next I'm gonna check for edema on the upper and lower extremities here. which I believe yes, I already did the upper extremities. I'm gonna rate that a 0. And there's no pitting edema on the lower extremities either. So upper and lower bilaterally are 0. I am real quick gonna try to find lower extremity pulses. So the popliteal behind the knee. I know. I am unable to palpate. Next I'm gonna go to the top of the foot here, where I think the dorsalis pedis. I am able to palpate those on both the left and right at a 2+, and then right on the inner here by the heel, posterior tibial. I'm able to palpate both of those as well at a 2+, so that's great. So that is cardiovascular, so I'm gonna move on to the abdominal, and I'm gonna have you lay back.
Okay. Oh, goodness gracious.
All right. All right, upon inspection, her belly looks equal on both sides. I don't see any masses, any growths, any lesions, bumps, bruises. No extravascularidity, no discoloration, anything like that upon inspection. So next I am going to auscultate for vowel sounds in all 4 quadrants, okay? Okay. Vowel sounds were present in all 4 quadrants. I'm now going to palpate. Any pain, tenderness on the touch?
Mm-mm.
Okay. I'm not feeling any hard areas, any masses, anything of concern. All right, I am now going to percuss. Okay, on percussion of the abdomen, I found tympani in 3 of the 4 quadrants. In the right upper quadrant, it was where the liver is, I did find dullness, so I'm going to try to palpate the liver, okay? Kind of go under here. Sorry.
Okay.
All right, and the liver is not palpable, which is fine because that actually, you don't want the liver to be inflamed. That can indicate some type of issue. So. Okay, Kelly Jo, you're good to go there. So one of the last few things I'm going to have you do is just check your musculoskeletal, okay? I'm going to have you roll your neck, and then go ahead and nod for me, and then back and forth, yes, perfect. Can you shrug your shoulders? Awesome, that's cranial nerve 11 intact. Can you put your arms out to your side? Can you do big arm circles, small arm circles? And touch your shoulders. Good. And your wrists. Good. Can you grab my fingers? I'm going to rate finger grip at a 5 bilaterally. All right, can you bicycle for me with your legs? Go ahead and roll them in a circle. And can you just kind of kick them out one at a time there? Perfect. And roll your ankles. Perfect. Push down for me. And pull up. Good. She pulled up on my fingers, pushed down on my fingers bilaterally. The feet strength, I'm gonna give it a 5. So that is good. I am going to have you okay, put your finger on your nose for me, and when I move my finger, you move your finger to touch my finger. Does that make sense? Mm-hmm. Okay. Here. And back to your nose. Perfect. One more. Good job. Thank you. And back to your nose, yeah. All right, thank you. So the very last thing that I'm gonna have you do is I'm going to touch you with 2 different sensations. One is going to be sharp and one is going to be dull.
Okay.
I want you to tell me which is which, okay?
Okay.
All right. Go ahead and close your eyes. Here's the sharp for reference. Here's the dull.
Okay.
Okay?
Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull.
Perfect. All right. Thank you. Do you have any questions, concerns, anything like that for me? Okay, at this point, I am finished with my head to toe. I'm going to document these findings. I'm going to perform hand hygiene, and then I am going to leave the room and have the doctor come in. Thank you.